All right, everyone, it's after 12, so we are going to get started now. Good afternoon and welcome. I hope everyone is doing well and staying safe. My name is Rachel Rennick, and I would like to welcome you today to our Skin Cancer webinar in recognition of May being Skin Cancer Awareness Month. Before we get started, please take note of the Q&A box on the bottom right-hand corner of your screen where you can submit questions, and we will take questions at the end of the program. And with that being said, I'm happy to turn the program over to our dermatologist, Dr. John Zampella.
Hello, everybody. John Zampella here. Thanks for that introduction, Rachel. Everybody can hear okay? We got thumbs up?
Yeah.
Perfect.
You're good.
Very happy to be here this afternoon. Happy Friday. It's a beautiful day outside. And this is a great way to kick off the summer and spring season here. Happy to be with you to talk to you about keeping your skin healthy as we break into summer. As Rachel mentioned, we have May being Skin Cancer Awareness Month. So it's a great time to talk about keeping your skin safe in the sun while also being able to enjoy your time outside, especially as things start opening up. This is going to be hopefully an opportunity to give you some information on ways to keep your skin safe, especially as May leads into June. June is Pride Month, and hopefully, I don't know if anybody saw, if anybody's interested in the Pride events, but they just moved, I think, a lot of the Pride calendar to July 4th weekend to take advantage of the new New York State guidelines for being safe during coronavirus. So looking forward to that. When this talk is going to be geared toward the LGBTQ population and community, so that's all of us here and maybe a lot of you listening at home. The reason for this is we know that there are a lot of healthcare disparities amongst the LGBTQ population, and amongst those is particularly in dermatology, there are some special needs that we know our LGBTQ patients need. And so this opportunity today will be particularly geared toward sun protection and skin cancer, because we know that LGBTQ patients have a higher rate of skin cancer. And, you know, my talk today will hopefully give you some education and information to allow you to be your own healthcare advocate, help you make good decisions regarding your skin health, and live a happy, healthy life with wonderful, beautiful skin. So my goals for today are to give you some practical information on skin cancer, skin care, and skin health. We'll talk a little bit about some different societal perceptions and like how this kind of influences our perception of our skin. We'll get into some maybe areas of controversy regarding vitamin D. We'll talk a little bit about skin physiology as well. Don't worry, you don't need to have a biology degree. This will be pretty straightforward. We'll talk about, you know, how the sun damages our skin, how we can protect our skin. And at the very end, everybody always likes to know, well, can I reverse sun damage? And we'll talk a little bit about that at the end. Okay, I'm going to take a little a novel approach to this lecture and talk about and frame everything around myths in skin cancer and skincare that you may have heard of, and we'll look toward finding some truth surrounding some of these controversies. Obviously, Rachel mentioned that there'll be Q&A at the end. I generally like to have an interactive type of lecture style, but obviously the video visits or these video lectures are not as conducive to that. But if you do have something that you want to poke in a question as I'm talking to clarify something, feel free to type those messages into the chat box. Okay. All right. So the first thing I want to talk about is this myth that skin cancer rates are decreasing. And this is not true. Actually, skin cancer rates are increasing. Over the last 30 years, we've had nearly a doubling of rates of certain types of skin cancers, particularly melanoma, which I will talk about later. This plot here does show the rates of melanoma in both men and women over the last 30 years. But also, in addition to that, these graphs are the same for other types of skin cancers, namely basal cell skin cancers and squamous cell skin cancers. And this is particularly interesting, especially because if you look over this same time, over the last decade or so, interest in skincare is increasing. This is a Google Trends plot, which is something anybody can do. You can go into Google and type in a search term, and it will tell you how often people are searching for that particular term. And you can see over the last, 10 years or so, the rates of interest in skin cancer or in skincare are increasing. And so you would think if people are interested in skin health, why are rates of skin cancer still going up? And so this is interesting because there's lots of potential reasons for this, right? And a lot of these have to do with some societal perceptions, mostly actually related to a focus on being healthy, this trend on being healthy. And so people want to be healthy kind of on the inside, and the societal perception that being healthy on the outside might be looking tan, right? And so how you get that tan and that kind of stuff all feeds into our rates of skin cancer. That ties in nicely with social media, right? Everybody's looking at their Instagram all day. We're posting selfies of ourselves, and looking tan makes us seem more attractive again because we have that societal perception. And getting to that tan is one of the risk factors that we'll talk about for skin cancer. I also point out that with social media, that does increase the amount of misinformation surrounding healthcare, misinformation surrounding lots of things, but particularly around healthcare. And so today also I'll be going into some of that. There's lots of other things that have kind of led into increases in skincare and skin health education, right? We're seeing all these ads on our Facebook feeds, and things are becoming cheaper, right? You can't go online without seeing some new skincare cream that's coming out. And so all of these bombarding ourselves kind of have led to this increase in skincare interest. And so that brings us to our next myth. Social media is a great resource for medical information. And this is sort of true. This is a plus minus here, right? So some of these figures are rather interesting. 2/3 of Americans get healthcare information from social media, and a bunch of people also find their doctors on social media, which, if you were to talk to somebody 10 years ago, this would be unheard of. And the benefits of this are that people are able to kind of research and learn information when maybe you don't have health insurance, or maybe you don't know where to get information. And social media can be a first step toward getting that education, and particularly amongst patients who have rare diseases, right? Some rare skin diseases like blistering diseases. Patients are able to find each other and develop a community surrounding these rare diseases, and that definitely provides patients with a sense of satisfaction, which is a great thing about social media. On the other hand, with social media, you have all of the risks that go in tandem with that, right? Anybody can post information regarding health care and skin cancer, right? There's not a lot of vetting regarding people's qualifications. And on that same token, if people aren't qualified, nobody is looking to see if the information being posted is accurate or helpful or even a reasonable option, right? And so actually one of the residents at NYU a couple of years ago did this study in dermatology and showed that of posts to the Instagram handle #dermatology, only 5% of people making those posts were board certified dermatologists. And so what does that mean? That means there's a lot of people out there giving information that they might not necessarily be qualified to make. And so keeping that in mind when you're looking for healthcare information on the internet can be important. And so I like to always talk about how Dr. Google is not a good doctor. I always encourage my patients to be informed about their healthcare decisions and about their healthcare in general. But taking that information and using it appropriately is important, because when you go on the internet, always is obviously going to show you the worst case scenario, and obviously that leads to patients having a hard time dealing with some of those issues. So where to get your information from? From a skincare standpoint, find your local dermatologist. If you don't have one, it's always good to start a relationship before you need have an actual problem. And so NYU is filled with good dermatologists. If you're looking for somebody, certainly head over to the NYU website, and we're happy to see you and take care of you. I like to throw these up here as well. These are some reputable websites for skincare information surrounding both skin cancer and other skin diseases. The American Academy of Dermatology is like our governing organization, and they have a whole section dedicated to patients and information for the general public. You can go on here and type in any skin disease or even skincare, sunscreen, that kind of stuff, and they'll give you information on that. Similarly, this website, DermNetNZ, comes from some dermatologists in New Zealand. New Zealanders are great dermatologists. They get a lot of skin cancer in, south of the equator down there. And so this information that they get, I even use sometimes to get information surrounding dermatologic diseases. So two good two good sources of information for you if you so need it. All right, so that brings us to your doctor information and your next myth. Your doctor comes in and says, never go in the sun. Is that true? Sorta. And so I'll go through some things of why this is and isn't true. So, the sun is one of our three eternal enemies in terms of skincare, right? We have the sun, we have the relentless march of time, and we have gravity, right? Pulling everything down. And so what do we do with the sun? We need it. Obviously, all of our energy comes from the sun. It's this big ball of burning gas in the center of our solar system. And the only reason life is able to happen on Earth is because the sun provides us with a ton of things, right? So of the light that comes to Earth, 50% is infrared. That's heat, right? That's what we're feeling outside today on this beautiful Friday. 40% is visible light. That's what allows us to see. But the problem in this spectrum is this last one, this ultraviolet light. And ultraviolet light is really what is wreaking havoc on our skin. So I think when answering that question, never go in the sun, or that myth, never go in the sun, I think there's three things to consider. One, your overall health. The second is your skin health. And then the last one is cosmesis, right? This is our fancy word for like how beautiful, quote unquote, or what your skin looks like. And obviously, our skin for a lot of people is the outward manifestation of how we feel on the inside. And so people care about this component. And if you do care about this component, protecting yourself from the sun can be is an important part of that. So when we talk about overall health, we know that the sun has a lot of beneficial effects on people's health, right? We know it certainly helps with our moods. This is why if you go in the wintertime, people get what we call seasonal affective disorder, right? So you get sad in the winter. This is why also as you go north along the on latitudes, right? As you go to Northern Europe, for example, rates of depression are higher, rates of suicide are higher, right? That's just a lot less sun. We also know that things like cardiovascular disease and hypertension are also improved with sun exposure. And the reasons for this are varied, and we don't necessarily really understand them. And so, getting some sun from this standpoint could be a good thing. And in fact, this one study from Sweden showed that even in terms of skin cancer, people who have melanoma, who actively avoid the sun, may die earlier. This study was only done in women, but is an indicator that, even in people with skin cancer, the benefits of sun for our overall health might be important or more important, or one piece to being more healthy compared to the risk of dying from skin cancer. And so, this might be a little surprising to you that a dermatologist is telling you this, but this is, we follow the data, and this study was a very good study. These are questions that we have to kind of reckon with. And maybe you've been thinking to yourself, as I've been saying this, that, oh, I clearly know the answer to this. The answer is, we need vitamin D. And so I would bust this next myth saying you need the sun for vitamin D and say that this is, nope, not true. In fact, a lot of vitamin D that we get comes from the food that we eat, right? So, dark green leafy vegetables, fish and other seafood, obviously things like milk and dairy products contain a lot of vitamin D. And so do you need the sun to get vitamin D? Absolutely not. We also have supplements nowadays that you can use to get your vitamin D. And whether vitamin D is important for those things that I mentioned, I'll talk about in a second. But vitamin D, just so to review for you, if you never heard this before, vitamin D is a hormone, right? The precursors to vitamin D actually live in our skin. And those precursors to vitamin D get activated through UV light, and then they leave your skin and they go to the rest of parts of your body to exert their effects. Okay, and lots of things affect this, right? You can imagine the darker your skin is, the less light goes through to activate these precursors. If you live somewhere really far north in the wintertime, of course you're going to be vitamin D deficient in the winter because you're not getting any sun. If you live in a very cloudy place, right, you're not getting sun to activate that vitamin D. And so in those places, right, the foods you eat and supplements you take are even more important. Okay, and so getting your vitamin D, and actually getting vitamin D from the sun doesn't require all that much sunlight. It's about 10 minutes a day on your arms and legs kind of thing will get you your daily allotment of vitamin D. Okay. And so this might be something else that kind of you may not have heard about before, but how important actually is vitamin D? The only thing we know for sure that vitamin D does for us is provide strong bones. So we need vitamin D for our calcium metabolism and to keep our bones strong, prevent osteoporosis. Over the last 30 years, there have been lots of studies that link or associate low vitamin D with things like cardiovascular disease, low blood pressure, and certain types of cancer. However, a lot of these studies haven't necessarily proven to be completely true. And there's two things to talk about here. First, if you look at over the last couple of years, there have been some studies that show supplementation of vitamin D to raise people's vitamin D to normal levels have not necessarily caused a reduction in things like the breast cancer and colon cancer, which are some of the things that have been linked to low vitamin D. And so there's a couple hypotheses for this. Is vitamin D really that important, right? This is becoming a new thing, certainly for those other kind of associated conditions. Or is there something special about vitamin D that comes from the sun that actually might be protective for some of these things? So these are questions that have not been answered, something that you should stay tuned to over the next several years in terms of vitamin D. So, your vitamin D important for your bones, but the other things still a little bit of a question mark. All right, busting the next myth. Get one sunburn at the beginning of the season and that protects me. You get a little tan. Well, busting this myth because any time you get a sunburn, that is DNA damage. UV radiation is a known carcinogen, right, for skin cancers, but also for other things, right? If you expose other types of cells to UV, that also causes cancers. We know that if you get sunburns, you increase your risk of skin cancers, particularly melanoma. If you get a blistering sunburn, you definitely have an increased risk of getting melanoma. And we know that on the converse side of that, if you block UV light, right, if you protect yourself from UV light, your risk of skin cancer goes down. And so what is sun doing to our skin that is causing this damage? Well, it's a carcinogen, and it does that through destroying DNA, right? When the sun penetrates your skin and goes to the nucleus of your cell, which contains all of your genetic information, those UV rays break up your DNA. And your DNA is the blueprint for how your cells are supposed to make proteins and interact and function on a day-to-day basis. And so when you destroy that blueprint, right, it's like ripping up the instructions to your electronics, right? There's nothing to go back to and say how this might work. And then UV light, we like to break down into two main categories, right? There's UVA light and there's UVB light. And the effects of each of these are actually a little bit different, right? So when we talk about UVA light, I like to tell my patients, UVA light ages you, UA for ages, right? This is a longer wavelength of light. It penetrates deeper. And so it has more effects on things like collagen production and can, over time lead to degradation of collagen. It penetrates through clouds, right? So if you're outside on a sunny day, this is why, you might tan through the clouds, or you might even get a sunburn through cloud because some of the UVA is coming through. And then UVB light, UVB for burns, this is primarily this is the high energy UV that causes burns in our skin. It's the most abundant type of UV light that hits the Earth's surface, and it's the most likely to damage your DNA. And so you don't have to be a pathologist to see under the microscope what happens in sun damage. Right on the left there, over here, you can see this nice pink collagen in your what we call the dermis, the second layer of your skin. And in sun damaged skin, you can see kind of this purple, poorly organized degraded collagen. We call this solar elastosis. This is kind of your elastic fibers kind of break up. And so this is what makes your skin kind of less spongy and less supple with sun damage, right? So you don't necessarily need a pathologist to see that the sun is certainly exerting its effect. And what does this look like in real life? This is a great photo of a truck driver. It's a famous photo. And you can see that on the left side of his face where he was driving all his life, the UV light came in through the window and really aged his skin as compared to the right side of his face, which was less exposed. And so we know UV light through the DNA damage causes skin cancers. We know it causes premature wrinkling. The decrease in collagen or degradation of collagen is what causes our skin to get kind of crepey and saggy over time. As we get older, with that thinning skin, makes us bruise easily. And all of that stuff are things that we don't necessarily want for our, cosmesis of our skin, right? In addition to that, freckles and age spots in women who get melasma, this is kind of the darkening of the skin on the face. And all of that is worsened by sun and UV, okay? Except our societal perceptions of this are not so good. We always think like, oh, as I mentioned, tan is beautiful. And we kind of crave this idea of being a little sunburnt or sun-kissed or going to the beach, right? And so that's kind of exemplified in this cartoon. And it's something that we should really fight against. And so brings us to our next myth. And so people like to say, I go to a tanning salon before I go on vacation to get a base tan so that I don't get burned on vacation. And this is absolutely wrong. And it's very, people's experience with this might be that, yes, you go to the beach and you're less likely to get a bad sunburn. But the truth is, from a molecular standpoint or from a DNA damage standpoint, it's actually not quite true. And in fact, I like to tell my patients, never go to a tanning bed. Tanning beds are like cigarettes for your skin. One of the worst things you can do, okay? The issue with going to a tanning bed before you go on vacation, say, is you're really getting double the amount of UV, right? So you go into these tanning booths, which are not regulated. You don't know necessarily what type of light you're getting. You're getting UV light that is extremely close to your skin. So very high energy, very high concentration of light, very close to your skin, which is even more potent than, being on the beach in some cases. And so you go to get the tan, you go to your tanning booth to get your base tan, but then you still go to the beach and sit in the beach for 8 hours in a day. So you're getting that sun plus the sun from the tanning booth, and that's double the amount of UV and double the amount of DNA damage, even if you're not necessarily getting a sunburn when you're at the beach, right? And so this is all important, and understanding why that myth is false. And we know that people who go tanning increase the rates of melanoma, squamous cell carcinoma, and basal cell, which are all types of skin cancer, by significant amounts. And so I like to tell my patients, avoid doing this at all costs. Unfortunately, we know amongst the LGBT community, particularly in gay and bisexual men, much more likely to use tanning booths compared to their straight counterparts. And so something, again, raising education, raising awareness around this issue to really improve our skin health and how we take care of our skin and prevent skin cancers and all of this kind of stuff. So you might be thinking, okay, I go to the beach, whatever, I'm not going to go tanning, but my skin can heal, can't it? I can go to the beach and get a sunburn and heal. And this is true. Your skin does heal. Your body's an amazing, your body is really amazing for its capacity to regenerate. But the effects of this in the long run are still not so good, right? So first of all, you can heal, but you don't necessarily see all the damage that you've created, right? So on the left there, you can see that this woman's face that looks normal to the naked eye, but if you've seen these kind of either on social media or on the news, these kind of UV cameras that if you look at it from a UV camera, you can see all of the areas of UV damage in this person's skin, right? And this is, even though your skin looks normal, you're looking at the DNA damage here and under these UV cameras that your skin has sustained over, however long you've been in the sun. And indeed, we do have defense mechanisms against the DNA damage, right? Your skin, has DNA repair mechanisms that for when these DNA breaks occur, your skin cells go through and try and repair that damage. And your skin does things like get tan to protect from UV light, right? So your ability to tan, or your ability to make melanin, which is the pigment in our skin, is meant to absorb and protect our skin cells' DNA from DNA damage. And in fact, tanning happens really in two stages, right? When you go out in the sun and you stay there for 8 hours, you get tan that day. That's what we call, that's immediate tanning. That's when your melanin actually gets kind of activated. We call that oxidation of melanin. And that's what turns you immediately dark. And then when you go home, 2 to 3 days later, you kind of get more tan as time goes on. That's what we call delayed tanning. And that's actually the increase in production of melanin in your skin. And actually interesting, regardless of your race, so you have melanocytes in your skin, right? These are the pigment making cells. Regardless of your race, you have the same number of melanocytes, which is interesting to some people. The difference between lighter and darker skin is actually the shape of how our melanin is stored in our skin and the type of melanin. Some people have what's called eumelanin, and some people have what's called pheomelanin. And these are kind of different types of melanin that give us different pigmentations. And so the point of that was, our defenses eventually fail, right? So your skin has a regenerative capacity, but at some point those fail. You get brown spots like freckles, you get that crepey skin, and then you may end up with the ultimate failure of our defenses, which is skin cancer. Okay, so when our DNA in our skin cells is damaged, at some point where the damage occurs can lead and can be unfixable by our repair mechanisms, and ultimately that can lead to the development of skin cancer. And you can see some of these here. We'll talk about them individually, but skin cancer is interesting to me. I'm a dermatologist, but I think it's also interesting to a lot of people out there because it's the most common human cancer, period. You can add up breast cancer, colon cancer, lung cancer, lymphoma, add them all up. Skin cancer is way more, probably 2 or 3 times more common than any of those. And so what does that mean? That means, a lot of people in the United States and around the world will get skin cancers. In fact, 1 in 5 Americans will have a skin cancer by age 70, right? So that's not an insignificant number. You probably know people, your grandparents, aunts, uncles who've had a skin cancer, okay? And the risk factors for this are things you might have heard of, right? So obviously, if you've already had a skin cancer, that's going to be your biggest risk factor. Skin cancers can run in families, right? So if you have a family history, that's also a big predictor. If you've had a lot of sunburns or a lot of sun exposure, that's a big predictor. Redheads, sorry, there is something intrinsic about red pigment that is carcinogenic, especially in the skin. So red hair is an independent risk factor for skin cancer. So sorry, redheads. Obviously, indoor tanning is a big one that I already mentioned. And I said, avoid at all costs, right? That's within our power. People who live at high altitudes, and then hopefully not a lot of people on this call, but immunosuppression can also increase risk of skin cancer, namely people who are have solid organ transplants, like kidney transplants. The immunosuppression from for those medical problems can lead to high numbers of skin cancer. So those are things, if you have any of those, reason to have a dermatologist if you don't already. All right, which brings us to this, but let's dive into some skin cancer specifically. All skin cancer is the same. Actually, this is one of the biggest problems I have kind of educating patients when they come in is, understanding the differences in the different types of skin cancers, right? So this is my little chart of the different types of skin cancers. Everybody tends to know about melanoma, right? Melanoma, which I'll talk about, is the scary skin cancer. It's the deadly skin cancer. And so that's why it's in the news a lot, but it's actually the rarest of them. The bigger group of skin cancers are these non-melanomas, or what we now call keratinocyte carcinomas, which is basically the cell they come from, right? Melanoma comes from melanocytes. These are the pigment-making cells, and keratinocytes are the other skin cells you have. And so if you have a carcinoma of the keratinocytes, we call those basal cells and squamous cells. Basal cell comes from the basal layer, right? That's why that is. And squamous cell comes from the squamous layer, which is a little bit higher up. The basal cells and squamous cells are way more common than melanoma. Literally millions of people get these every year. And it's important to know that they don't become each other, right? If you have a history of basal cell, that basal cell will never become a melanoma, and vice versa, right? Melanoma never becomes the other. This is like saying, there are different types of cancers. It's like colon cancer doesn't become lung cancer, right? They're coming from different cells. And so, as I mentioned, melanoma is the scary skin cancer, right? This is the one that can shorten your life, right, or take you out of the game, kind of thing. Is the rarest of the three types of skin cancers I mentioned, but because of its deadly nature, it's the one we tend to focus on. It's the one we know the most about. And in fact, something like 7,000 people die of melanoma every year, and the rates are going up. And so if you remember back to that first slide I showed you the rates of skin cancer, particularly melanoma, increasing over the last 30 years. And so this is a real issue. A lot of dermatologists talk about the epidemic of melanoma. And the reason this is the thing to know is melanoma, if you catch it early, it's surgically cured, right? You cut it out, and the survival from an early stage melanoma is very, very high. However, it progresses, right? If you get an invasive melanoma, the mortality or the percentage of people who die from that melanoma is actually relatively high. Recently, we've made some important strides in advanced melanoma with new immunotherapies and immunochemotherapies that have really helped in the survival of these aggressive invasive melanomas. But obviously, if you can catch it early, that's always best. Over 50-year-old white men and young women are the people we worry about melanoma. Obviously, melanoma is more common in white people, but it does happen even in darker skin or skin of color. And when it happens in skin of color, places where it happens: feet, under the nails, and the back of the eyeball. And so melanoma is not just a disease of white people. It can happen everywhere, but just the different areas that we need to worry about in skin of color is important for people to know. Melanoma is the skin cancer that mostly runs in families, right? It can run on a gene kind of thing. And so if you have a family history of melanoma, very important to see your dermatologist. Make sure you're getting your skin checked pretty regularly. Which brings us to the other skin cancers, the keratinocyte carcinomas, basal cells, and squamous cells. On their own, these are the most common types of skin cancer, right? So 5 million people every year get a basal cell. About 1 million people a year get squamous cell. And, I tell my patients that in general, people don't die from these. And it's true. Basal cells and squamous cells, as a percentage, don't kill many fewer people than melanoma. However, if you look at the actual numbers, the total number of people who die from squamous cell every year is actually quite high. It's almost double what number of people who die from melanoma every year. And so this makes these skin cancers actually a real problem for our patients or for people. Except if you look at the percentage, right, 15,000 over 1 million cases every year, that percentage is really low as compared to melanoma, right? 7,000 people die every year, and there's maybe 80,000 new diagnoses of melanoma every year. So that percentage or that proportion is much lower. So we don't like to poo-poo squamous cell or basal cell, because they are certainly an issue, but as a relative percentage of patients who do poorly on these, it's pretty low. Okay, both of these we know are caused by UV light. Not really genetic as far as we know. There are some rare syndromes that can increase your risk of these, but I do tell patients, right, if you have you inherit your skin type from your family. So if your mom or grandmom had a bunch of basal cells and they're very fair, and you're also very fair, that just means you're just as susceptible to UV light as they are, and so protecting yourself can be helpful. Rates of these skin cancers are also increasing, and just like melanoma, right, when we get these, certainly in any case, if you catch them early, you cut them out very easy. Even if they're a little bit larger, cutting them out is usually the treatment. If these happen on the face or the hands kind of thing, there's a special surgery we use called Mohs surgery. I like to throw this term out there just so people have heard it before. It's just a special way to remove skin cancers on places where you don't have a lot of real estate, right? If it's on the tip of your nose, can't just lop off your nose. So it's a special way to keep the hole to remove the skin cancer as small as possible. And in fact, skin cancers know relatively few bounds, and can affect everybody. Hugh Jackman posts all the time how he's had like 3 or 4 basal cells over the last couple of years, and he puts them on. He's posts it to social media, trying to raise awareness surrounding sunscreen and prevention of these skin cancers. And so, doing the good work there, Hugh Jackman. So how do you protect yourself from melanoma and the keratinocyte carcinomas? Well, one of the primary things you can do is as I mentioned, if you catch it early, they're much easier to cure. So one of the easy things to do is to get a skin exam every year, right? Dermatologists, we train for 12 years to be able to tell the difference between a bad mole and a good mole, or a pimple and a squamous cell. And so getting your yearly skin exam is important, especially if you have a risk factor for getting skin cancer. And what do you, and then the other option is something you should be doing is check your skin yourself, right? Actually, about half of melanomas are picked up by patients. And so knowing what to look for can be super important and super helpful. And so we like to teach people the ABCDs of melanoma. So A meaning asymmetry. What does that mean? That means if you cut the mole in half, can you fold it over on itself and it's relatively equal in size and shape? The borders of the mole, right? Can you take a pen and draw those borders? Are they nice, clear, crisp borders, or or if that they're not, do the borders kind of fade away, which would be a worrisome sign? Color, right? Is it evenly colored, one uniform color, or are there multiple colors? Reds, blues, whites, this kind of stuff can be a sign of a skin cancer. How big it is, right? If we like to say bigger than a pencil eraser, that should be something you worry about. And then the most important thing, is it changing? Is it evolving, right? That E is probably the most important thing, right? Because some people do make moles with multiple colors or make big moles, right? That doesn't necessarily mean they're bad, if that's kind of how you make moles. But the big thing is, was it one way? Did it have symmetry at one point and then it evolved or changed to not have symmetry, right? And so these are things for you to look for in terms of melanoma. In terms of the other types of skin cancers, the basal cells and squamous cells, I like to tell my patients these can come up and look almost like anything. A little pimple that doesn't go away, a little sore that doesn't heal, a yellow spot, something that bleeds, any of those on your face or anywhere on your body could be a sign of a skin cancer, and things you should notice and bring to the attention of your dermatologist. So this one, that shouldn't be there like that. Let's see. This one is supposed to say drinking enough water will decrease your risk of getting skin cancer. And that myth is a big nope. Behind this is a picture of Tom Brady, in case any of you are football fans. He said a few years ago and made a lot of headlines that he drinks a lot of water, and so by decreases rates of getting sunburn and therefore skin cancer. But that is not true. That is never, I don't know where he got that information from, but is one example of how social media and getting your information from the wrong sources can lead to misinformation on a mass level. Obviously, he has a broad opportunity to influence people's behaviors, and so obviously you should drink water, but this does nothing to protect your skin from sun damage. And so the fact of the matter is here, how do you prevent skin cancers and look your best? The first 5 steps, and the only way we know other than avoiding the sun to prevent sun damage and skin cancers is sunscreen, 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 right? Now dermatologists like to get on their platforms about sunscreen, but realistically, it is the only thing we know to do to prevent UV damage, especially if you want to be outside, right? If you want to be outside, this is really the way to go. And so I like to give some sunscreen tips because lots of controversies surround sunscreen. We know that sunscreen reduce your risk of skin cancer. Both the basal cells and the melanomas. It also has been very well documented that it decreases signs of aging. Again, that's the same reason, right? If you're not getting that exposure of the UV light to your skin, you're protecting yourself from aging. And we talk about a couple principles when you're looking to buy sunscreen. First, the party line is SPF 30 is a minimum. The truth is, more recent data has shown that maybe higher SPF is better. They do these split face trials where they put SPF 50 on one side, SPF on the other side, SPF 100 on the other side, and they see which side burns. And the higher the sunscreen, the better they do work. So, especially if you have a risk of skin cancer, getting that higher SPF may be beneficial. SPF is only a measure of UVB protection, okay? There is a measure of UVA protection. It's called the PFA, protection factor of UVA, but it's not listed ever on a sunscreen bottle in the United States. And so the way you know you're getting UVA protection is your bottle has to say broad spectrum on it, okay? So when you're looking to pick up a sunscreen, make sure it has a good SPF and that it says broad spectrum. Otherwise, you might not be getting the UVA coverage. And so you might be protecting yourself against burning, but you're not necessarily getting that anti-aging effect, okay? All sunscreen SPFs are tested in under certain conditions, and those conditions are reapplication of 1 full ounce of sunscreen over your whole body every 2 hours. Okay, so when you go to the beach with that 8-ounce bottle of sunscreen and you come back a week later with a little bit still in there, you're probably not putting on enough sunscreen. Okay, and that's why people go to the beach and they say, oh, I get burned or I tan, even though I'm wearing sunscreen. We're not necessarily putting on enough. For everybody out there, don't forget the tops of your ears, back of your neck, back of your hands. If you're guys, if you're losing your natural sunscreen on your head, putting some sunscreen there also, because those are common places that people get sunburn, because we forget sunscreen, and they're places that get lots of direct sunlight. Okay, wearing hats, shirts. You can look for on some clothing now this UPF designation. This is what are in like sun shirts. It's like built-in sunscreen into your clothing, which is also very, very helpful, especially if you're going to be outside for long periods of time. There are 2 types of sunscreens that we talk about: chemical versus physical. Chemical sunscreens literally absorb UV light and then re-radiate it out as infrared light. So that's why when you put sunscreen on, sometimes you put on, you go outside and you get really sweaty underneath your sunscreen. That's because the sunscreen is actually heating up your skin. Okay, so that kind of makes sense, and it's doing its job. Physical sunscreens are literally like a shield, right? You put zinc or titanium on your skin, and that just kind of reflects the UV light off of your skin. The physical sunscreen tend to be pasty, so people don't really like them, but they probably work better, right? And a lot of baby sunscreen and stuff, these are gonna be mostly made out of zinc and titanium. And the truth is, a lot of sunscreens nowadays are mixed, right? So people don't like the pastiness of pure zinc, so they get zinc plus some of the chemical sunscreens, and oftentimes those are a little bit nicer to put on. Get this question all the time: what's the best sunscreen? There's not a good answer for this, to be honest. I tell people, whatever you like, whatever you're going to wear, sunscreen that's going to work with your skin, right? If I put one sunscreen on and it breaks me out, but it doesn't break you out, right? You pick the one that works for your skin. I like to add as a little asterisk to this: Consumer Reports every year does a test on sunscreens to say, is what's on the bottle in the bottle, right? If it says SPF 30, is it actually SPF 30? And a couple win that, or in that top every year. Actually, the Equate brand from Walmart tends to almost always be in the top 5. And then the La Roche-Posay Antelios brand also tends to be in that top 5 every year. That one's very expensive. So if you made a bunch of money in like Bitcoin over the last year or 6 months, maybe you can get the Antelios one, but otherwise you can stick with the other more affordable ones. We like to talk about not using sprays. Most of the spray goes into the wind and misses the target, which is your skin, and people get burned through it a lot. The one caveat to that is like scalp. So guys, if you're thinning, or women, if you're thinning on top, using some spray sunscreen on the scalp can be helpful. Bringing us to our next myth: sunscreens are bad for your health. You'll see this. The answer here is probably not, but we're still learning more about this. If you've seen over the past couple of years, these studies that come out say that, you put sunscreen on your body and it absorbs into your bloodstream. That is true. There have been a couple studies documenting that absorption of sunscreen. The issue with that is we don't know what that means. We've been using sunscreen for a long time, and there doesn't seem to be any like ill health effects from it, but something that we're studying more now. And if you're worried about this, the zincs and titaniums don't get absorbed. And so if you really are worried about the absorption, sticking with those is certainly helpful. And then these studies about sunscreen killing coral reefs. In my mind, actually, this is the biggest reason not to use a chemical sunscreen. Avobenzone and oxybenzone have been linked to coral reef bleaching. It's not a definitive fact just yet, but things people are working on. And again, if you're worried about the environmental impact, using the zincs and titaniums are going to certainly be more beneficial here as well. So our next myth: I have dark skin, I don't need sunscreen. Nope. We know that the sun has the same effects on skin of color as it does on lighter skinned people. You might not burn as easily, right? Because the pigment in your skin prevents the UVB, the burning from occurring, but it doesn't stop the UVA, right? Remember, UVA penetrates deeper, so you can still get the aging, you still get the color changes, the freckles, the sunspots, even if you have darker skin and don't burn as easily. And in fact, I mentioned that darker skin types are less likely to get skin cancers, particularly melanoma. But when darker skin types do get melanoma, they're much higher risk of dying from that skin cancer than lighter skinned people. And so the reason for this is probably several. Physicians probably aren't looking for skin cancer in darker skinned individuals as much. And people who have darker skin are probably less likely to go to the dermatologist because they don't think they necessarily need it. So I like to say, regardless of your skin tone, same rules apply. Sunscreen, get your skin checked, look at your moles, all of that kind of stuff. All right, getting toward the end here. So this myth that you need vitamins for your skin, nah. You probably don't need any vitamins, period, in fact, right? The FDA actually a couple years ago came out and said, we don't even recommend you take a multivitamin a day. We poop most of that out anyway. We get most of the vitamins we need from the foods we eat and this kind of stuff. Especially in this country, we fortify all of our foods. Most men are probably have iron overload because we put so many vitamins in our food. So I like to just tell people, listen, you don't necessarily need vitamins. Healthy life equals healthy skin. There's all these studies showing that if you're overweight, that might increase your risk of skin cancer. If you have diabetes and you get skin cancer, you might be more likely to have more severe skin cancer, all of this kind of stuff. And this is just to say, like everything, if you eat well and you exercise, all this kind of stuff, you're going to be healthier overall, and you're going to be have healthier skin as well. That same goes for diet, right? There's some studies showing that like beta carotenes from green foods and orange foods and this kind of stuff might help protect against skin cancer. And coffee seems to be associated with everything at one point or another. But for you coffee drinkers out there, this study showed that high levels of coffee intake might decrease your risk of skin cancer. So drink on, I suppose. I will put this here. There are a couple supplements that I do use in real life. There is some data for some of these. First is this niacinamide. This one might actually prevent a development of skin cancers. The studies that have been done in this were done for organ transplant patients who are immunosuppressed and get lots of skin cancers. And taking 1,000 milligrams twice a day of niacinamide might decrease that risk. And then I like this one called Heliocare. It's from a fern plant called Polypodium leucomotus. It's marketed as a pill sunscreen. Obviously, I don't market it like that when I tell it for my patients. It's, you take a pill and it does help prevent sunburn, but it is not a replacement for sunscreen. This is in addition to, right, maybe you're out at the beach and you missed your 2-hour time mark to put on sunscreen again. This can help kind of bridge that gap for the Heliocare. The bottle says take one a day, but actually that's not enough. If you look at the clinical trials for this, you need 2 pills every 2 hours, just like you're doing your sunscreen if you were to go get this. All right, getting toward the end here. This is the last section where we can talk about reversing sun damage. Sun damage can be reversed. It's not permanent necessarily. And so what are the things we can do? Well, a dermatology talk wouldn't be complete without talking about retinoids. Retinoids are all over the place now. These are derivatives of vitamin A. They are the only thing clinically proven to reverse the signs of aging, period. Everything else might help, but this has clinical trials showing just that. And it does all sorts of good things, right? It evens our skin proliferation, evens our skin tone, increases collagen production. And it does actually decrease the risk of skin cancer. If you put it on your face every day, sometimes we even use retinoids to treat skin cancers, right? So if people have a lot of really bad skin cancers, we put them on even oral retinoids to kind of slow that down. So it's something totally you can do, and you can see the effects of using retinoids on this patient here. She did very strong 0.1% retin A for a whole year, and you can see that benefit there. Alpha hydroxy acids also have been used to treat skin cancers. These are a double-edged sword, though. Obviously, we use them like glycolic acid peels and stuff for skin rejuvenation. But in the way that they kind of peel off the top layer of skin, that's been shown to decrease the rates of certain types of squamous cells and basal cells. They are a two-edged sword, though, because they do also make you sensitive to the sun. So if you do want to go outside, you're more likely to get a sunburn, and that's bad. Lasers, we use these for lots of cosmetic things to remove brown spots and red spots and all this kind of stuff. But maybe you've heard of like a Fraxel laser or resurfacing laser. We also use these in patients with lots of sun damage, right? Again, to kind of remove that top layer of skin, you're removing those bad cells, and that allows new cells to kind of proliferate. And so from that standpoint, from a skin cancer treatment and prevention standpoint, sometimes lasers are beneficial. And actually at Memorial Sloan Kettering, they're doing clinical trials that instead of cutting out basal cells, they're actually destroying them with lasers. And so that's kind of cool new technology that might be coming up down the pipeline. And this has nothing to do with skin cancers, but does have a lot to do with anti-aging. And so I always throw it in here at the end. Botulinum toxin or Botox, Xeomin, Dysport, these kind of neurotoxins that paralyze your muscles definitely help with wrinkles. People are talking a lot about preventative Botox, prevent aging. Does work well for that, right? But it's one of those things that if you're interested, totally something you can do. I'm happy to answer questions about that. So in the end, should you really avoid the sun? I tell my patients, enjoy the sun, live your life. We want you outside riding your bike and swimming and doing all that stuff. But wear your sunscreen. Don't get a sunburn. That's how you're going to prevent skin cancers. That's kind of how you're going to prevent anti-aging and all of that kind of stuff. So here are like your 10 tips if you fell asleep and you're just waking up now to the end of my talk. If you remember these 10 things, you will have taken something away from this lecture. So with that, happy to answer any questions. We have a few minutes before people.
Thank you, Dr. Zampella, for a great presentation. That was very informative and very timely on this beautiful sunny day. It's a good reminder to be safe in the sun. We will take some questions now. So if anyone has a question, there is a Q&A box on the bottom right-hand corner of your screen. So feel free to type in any questions. We have a couple questions here already. How dangerous are iron deposits on skin? Can the spots be removed or lightened?
Iron deposits. So I assume you're meaning maybe on the lower legs, something like this, what we call hemosiderin. Yes and no. Hemosiderin is often what happens when if you like bleed into your skin a little bit, the blood has a lot of iron in it, and I tell my patients the blood rusts in your skin. It does tend to go away over time. It can take years to do so. And if you want it to go away faster, you can use some lasers to speed that along. But sometimes it can actually really be a challenge to make that go away. And usually what happens, people get this on their lower extremities because of swelling in our legs and stuff allows like a little blood to leak out. And it's not that it doesn't go away or get better, but it's that we're constantly replacing that iron. And so over time it can build up.
Okay, another question here. Is there any advantage to seeing a dermatologist of your own gender and ethnic background because they have the same type of skin as you? Would they be more likely to catch skin cancer?
That's a very good question. I would hope that you would get equivalent care from a dermatologist, no matter who you or he or she or they are. Or at least I would say yes, I hope that would be the case. Obviously, when you go see someone who is more familiar with your skin type, it could be beneficial. And I would say this. I see very often, unrelated to skin cancer, but in terms of like hair care, for example. I have patients who African American patients who come with thick curly hair, and they've been to see like 13 dermatologists for how to take care of their hair, and a lot of dermatologists don't know how ethnic hair works. And so I'm like, seeing someone who is familiar with your skin type or your skin tone is definitely helpful. So I did a lot of training with ethnic hair, and so patients get shampoos to treat their dandruff of their scalp, but my African American patients may only wash once a week, and so that's just not enough medicine. So I would rephrase your question to say you should go to someone who is familiar with your skin type and this kind of stuff, but doesn't necessarily equate to better care if they're the same gender or ethnicity as you. So just making sure that they have some familiarity with your skin problems is probably the right answer.
Okay, great. Next question. Can you get skin cancer on an area that has never been exposed to the sun?
Yes, absolutely. So as I mentioned, in skin of color, the most likely places to get like melanoma, say, are bottoms of the feet, palms of the hands, under the nails, places that don't necessarily get in the back of the eye, in the mouth, places that don't necessarily get a lot of sun exposure. because remember the some of certainly melanoma, there's a proportion of patients that it's a genetic thing as opposed to a sun thing, and so you know, those patients can get cancer anywhere, right? And the same thing goes for basal cells and squamous cells, right? Sometimes I take basal cells off people's rear ends, and it's more, you know, a problem of maybe chronic inflammation, say, right? So people who have chronic wounds or chronic burns or these kinds of things, they also have a higher risk of skin cancer, and that's not necessarily related to the sun, but rather just kind of the damage to their skin prior.
Okay, Dr. Zampella, are there any sunscreens that you do not recommend due to having too many chemicals that can cause adverse effects?
So it's a good question. There's no sunscreen I don't recommend, right? I think from a dermatologist standpoint, you know, our main concern is with preventing skin cancers and stuff. I would say from my personal standpoint, you know, the avobenzone and oxybenzone are two that I tell people, you know, if you were going to avoid one, those would be the ones I would avoid, mostly from an environmental standpoint, right? Because the data on whether these kill coral reefs in really low concentrations, right, there's still a question on that. And so from that standpoint, yeah, I tell people, you know, if you wanted to avoid one, these are good ones to avoid. If you are worried, right, the zincs and titaniums are going to be the ones that are not absorbed and not as bad for the environment, and they probably work better too. So if you wanted to pick, you know, the pinnacle of all of those, you know, the zinc sunscreen or the titanium sunscreens are going to be your options there. The other thing to just consider, like sometimes the zincs and titaniums come in spray bottles now. As I mentioned, I don't really recommend spray bottles as a general rule, but there were some things about the titaniums in the sprays that if you inhale those, they can cause little granulomas in your lungs. So another reason to zinc and titanium in a cream, not a spray, and not chemicals. So that would be the long-winded answer to that.
Okay. Another question here. Why do LGBTQ have increased chance of skin cancer? What does sexual preference have to do with skin cancer?
So that study that I put up at the very beginning didn't really look to answer those questions. They just looked at numbers and proportions of patients. And it's something that there's ongoing research to understand. A lot of people blame it on tanning booths in terms of you know, extra exposure for LGBTQ patients. There may be other factors there too, though, as well, right? So, and this has nothing necessarily to do with the intrinsic LGBTQ like sexual orientation, but rather LGBTQ patients are more likely to have things like HPV, right? And so HPV is it can be a component in terms of driving the development of certain types of skin cancer, namely squamous cell carcinoma. So there's probably multiple pieces to that. One being, you know, the extra sun exposure, but two being maybe some diseases that are higher rates in LGBTQ patients that might also drive skin cancer.
Okay, great. If you are taking tretinoin, should you ever increase the strength?
Absolutely. If you're not getting irritated from your tretinoin, go up.
Okay.
There's some data, right? So when we use retinoids and stuff to treat acne, the higher the strength might not actually make much of a difference. But from a cosmetic standpoint, certainly the higher the strength, the higher the concentration, the better cosmetic benefit you get from it.
Okay. A couple more questions here. Can you treat SCCIN situ with 5, I might be pronouncing this wrong, 5-fluorouracil?
Fluorouracil. Yeah, we can. As a general rule, we like to cut out squamous cells. Basal cells also, and obviously cut out melanomas. Occasionally you get someone who has a squamous cell, like an in situ squamous cell that might be in a place that, you know, people don't want surgery, right? If it's on your face or on your groin or on your foot, something like that. And you can use 5-fluorouracil to treat those. You have to do it for a long time, probably like 6 or 8 weeks of daily application is what the studies have been done for. And the cure rates are much lower, right? If you have squamous cell situ, the cure rates with the cream are like 70, 75%. as opposed to, right, if you cut it out, the cure rates are like 95%. So there's always that balance. I'll do the creams in like some of my older patients who, Dr. Z, I really don't want to get surgery, this kind of stuff. Don't want to have stitches. You might do the cream.
Okay. A couple more here. Do you recommend that primary care biopsy skin lesions that are suspicious, or should we just send to derm?
There have been some studies on this. I like to say that if the primary care doctor should be comfortable doing biopsies, as long as they're okay with interpreting the results of that biopsy. I think the lack of dermatologists in like rural areas or places that don't have a dermatologist, primary care doctors often have to step into that role as a dermatologist. I think the big thing there is, if you're going to take a biopsy, you should know what to do with it, right? So if the biopsy comes back as a squamous cell, you should know that either it needs to be cut out or need to be sent to Mohs surgery, this kind of stuff. So yeah, I think primary care doctors should be able to do it, but need to know what to do with the results.
Okay. I had Mohs surgery for squamous, was told it was gone. What are the chances of reoccurrence?
The risk of that one recurring is really low, like less than 1%. Mohs surgery for squamous cell is like cure rate greater than 99%. The risk of you getting another squamous cell, though, is not low either, right? So people who get one basal cell or squamous cell, 40% chance you get another one at some point in your life. And it doesn't necessarily have to be at the same place, could be somewhere else. But I would say risk of that one coming back really, really low.
Okay. Are tinted sunscreens as effective?
That's mostly based on the SPF. There is some benefit to the tint itself, right, which kind of can absorb some of the UV light on its own. So I actually really like tinted sunscreens for that reason. And especially the tinted sunscreens now might do something that we're learning about is block visible light, right? Damage that you might get from these high intensity blue lights from that light that come from our computer screens and stuff. It's very early in its infancy in terms of studying these effects. But the tinted sunscreens may do better at protecting against those high intensity blue lights.
Okay. We have one more here. Let's see. I was recently diagnosed with hyperpigmentation, inflammatory reaction in my lymph nodes, and was given adapalene for my skin, which has given me a reaction. Does this condition increase my risk of skin cancer?
Not that I know of. The adapalene will help with the pigmentation in your skin, but probably won't do much for lymph nodes. The reaction that you're having could be normal, right? All retinoids irritate the skin, right? So you have to kind of parse that out a little bit. If it's truly just a retinoid dermatitis, right, the irritation from the retinae, just backing off a little bit and going a little more slowly as you use it might be beneficial. But if you're truly having a reaction to the medicine, then that's something you should talk to your dermatologist about.
Okay. Do you recommend zinc pill supplements along with niacinamide?
I do recommend zinc for things like warts and stuff. For treating for like the skin cancer prevention, I don't know of a study that showed that zinc was beneficial. However, logically, as I mentioned, in certain patients, right, HPV can be a driver of some skin cancers, and so there are some studies showing zinc helping clear HPV virus, and so from a logical standpoint, could be beneficial, I would say.
Okay, and the last question here, what are the symptoms of skin cancer behind the eyeball?
Ooh, this is what keeps dermatologists up at night. Sometimes none. Sometimes there are none. It's a really tough one, right? So if you've ever had an eye exam and they tell you have a mole behind your eye, right? You should get your yearly skin exams and yearly eye exams. The problem with some of the most deadly melanomas, right? Because remember, you have melanocytes in places not in your skin, right? I mentioned the back of the eyeball, but you have melanocytes in your brain, you have melanocytes in your adrenal cortex. right? So sometimes we get what's called a melanoma of unknown primary, and which means we never find the melanoma on your skin, right? Where did the metastatic melanoma come from? Sometimes it doesn't come from your skin, it can come from any of those other places, and we don't always find that, right? Don't let that ruin your weekend, though. Those are all very rare things.
Okay, and that is all the questions. We have a few very nice comments in here. There was an excellent presentation, and thanking you, and I agree with that. Thank you so much, Dr. Zampella. That was great information. Thank you for presenting today, and I would like to thank everyone for tuning in, and enjoy your weekend and be safe in the sun.
Love that. Take care, everybody.
Bye, thank you.
Bye-bye.